Here we go. Okay, now what we're going to do is, Zoomers, can you hear me?
Yep.
Yeah.
Okay, good. I don't have a picture of you anymore. I'm not sure what happened there. There you are. Okay. Okay. What we're going to do is we're going to talk about the origins of health systems in the world. Okay? And one of the things as you read is you're going to learn about a guy named Beveridge. A guy named Beveridge. You didn't drink him, he was a person. And a guy named Bismarck. Claire, are you with us? I can't see everybody anymore.
Yep.
Have you heard of Beveridge?
Yeah, he helped establish the NHS system in the UK.
Exactly. He created the national health system in the UK. And the national health system in the UK is of one philosophy, political philosophy, and the German healthcare system, the Bismarck healthcare system, is a different one, okay? So I want to talk for a few minutes, about Bismarck. He was the Chancellor of Germany in the 19th century, in the 1800s, sort of the middle of the 1800s. And his boss was named Billy, Kaiser Wilhelm IV. So how do you get to be Kaiser? What does Kaiser mean? Anybody know? Kaiser
It's like a king.
Kaiser, Caesar.
It's
Emperor.
like a king. You're born to it.
Exactly, okay? These are all royalty. So as Ophir says, Kaiser William IV got his job because of Kaiser Wilhelm III, who I assume was his father. I mean, maybe not, maybe the names were different, right? So royalty is inherited, right? But then royalty doesn't really want to do anything other than make big decisions, so they hire people. So Otto von Bismarck, famous man for a variety of reasons, is the Chancellor of Germany in the middle of the 1800s. So what do you think Kaiser Wilhelm's social philosophy was? Liberal or conservative? Conservative, sure, right? He's a Kaiser, he's an emperor, okay? He's a king. So who's he going to hire? A conservative to work for him. So Bismarck's a conservative guy, okay? There's another guy in the picture, however, and his name is Karl Marx. Now, I'll try this on this group, we'll see what happens. He was one of the Marx brothers. Anybody heard of the Marx brothers? Katie's heard of the Marx Brothers. Dan's heard of the Marx Brothers. It was a comedy team in the early 1900s, mid 1900s. Okay, they had nothing to do with Karl Marx. Karl Marx may have had a brother, so maybe it was the Marx Brothers. But no, these are different people. Karl Marx was a political philosopher, and his political philosophy was all about, what's the famous book he wrote? The Communist Manifesto. So he believed, he was German, and he believed that the world was very unfair because there were class systems. So we're going to look at a picture here. On the right, you see a famous picture called The Man with the Hoe. And I'm not showing you the presentation version of this slide because Dan and I gave up on trying to get this thing to work right. So it's a little hard to see. I guess I can enlarge it. Zoomers, you can see this, right? The man with the hoe? Yep, okay.
Yeah.
So this is what life was like for peasants in the middle of the 18th century. Does he look like a happy? What's his happiness report going to look like? 2 out of 10, 2 out of 12. This is not a happy fellow. Why? Because his life is hopeless. Okay? The world that he is born into is the world he will die into, and his children will be born into the same world. Okay? On the left is another picture of the 18th century, 19th century. What is it? What does it show you? The Industrial Revolution. So what happens in Germany is the Industrial Revolution comes to Germany. Was this good or bad for workers? Well, Marx decided it was bad for workers, that they were being hugely taken advantage of. Okay? And he said the workers need to revolt against the rich, take over the country. We all should live communally. Everybody should be equal. Let's share everything. Lauren, where in Israel do people do this? Live communally. Share
Kibbutz.
everything. Yeah, where? What kind of communities?
On kibbutz.
Kibbutz. Right. I think, Ophir, you said that too, right? Or one of you guys on the Zoom.
Yeah,
Okay?
me.
Okay, right? That's what a kibbutz is. It's communal living. It's communism. It's nice to live in a kibbutz if you want to live there. Okay? So Marx said everyone is going to want this. Everyone is going to like it. Everyone will have the same income and everyone will benefit from it. It's wonderful. It'll be heaven on earth. That's what Marx said. Now, how did the rich people feel about this? They did not like it. They didn't like it at all. So conservatives, are they going to like communism or not? They're going to be very opposed to communism. Okay? They are conservative. So what happens in Germany is that, in fact, the Industrial Revolution raised the living standards for many people in Germany. Communism came to Russia, which it wasn't supposed to do. It was supposed to come to Germany. And the man with the hoe is actually the people who became communists in Russia. Not really the way it was supposed to work. In Germany, it didn't. And one of the reasons was because Bismarck was a smart guy. And he saw what Marx was doing. And what did he say to his boss, Kaiser Wilhelm? There's a threat here. Karl Marx is a threat. If he gets these workers to really revolt, then what happened later in the 20th century, what happened in the Soviet Union would have happened in Germany. All the rich people would have been thrown out of their mansions, the poor people would have moved in, and the rich people would have lost everything. Okay? Didn't happen though, because Bismarck was a smart guy. So as a politician, what did he say? What do politicians do?
They kill their opponents or imprison them.
They kill their opponents? No, Ophir. That's what happens today. That's not what's supposed to happen, okay? You're listening to too much Donald Trump and Benjamin Netanyahu. What's
Coalitions?
coalitions? Exactly. Okay. Go back to the slide I just showed you where the lines cross. Different interests. When you have a coincident interest, politics happen. Okay. So here you have Otto von Bismarck, who's a conservative, but who is scared to death about Karl Marx. He is worried he will lose his country, let alone his boss, okay, the Kaiser. So he's got to come up with a compromise to placate, to satisfy, to calm down the German working people. And he comes up with two programs he's going to do. One is a pension for old people. It's the first national pension gets created in Germany. Classic compromise. How old do you have to be able to get your pension in Germany in 1860? 65 years old. How many people live to 65? Very few, right? We know that. Today, yes, but back then, no. So they didn't have to cover very many people. And where did the money come from? From the workers. But they created something so they could say to them, you don't need to sign on with Karl Marx. We'll take care of you. So one thing he did was a pension plan, and the other was health insurance. So the first health insurance came from Germany, came from Bismarck. It's called the Bismarck model of healthcare. Private insurance, worker-related insurance. People pay into it. It is not given to them by the government. They are participants in it. A relatively conservative approach to healthcare. But it's the first health insurance and really the first health system of care in the world. Okay? So that's the origin of that. Now, I'm going to give you one more, if I can find it, hold on. Okay, now, just a minute.
When you say they added health insurance, you mean like a full health insurance, or if you're working and you get sick, then you will get paid for sick days? Because we see health insurance may be a bit different.
It was kind of like health insurance in the United States. In other words, you paid into it, you got sick, you got coverage. Okay, that's simplistic, Ophir, but it was kind of like health insurance. Okay, now hold on. So I'm trying to find something I can't find. So just a minute, everybody. Okay, this is not working. Just a minute. Okay. Now, Zoomers, just give me a minute. Yeah, thank you. Okay. So here we have Bismarck at the top, right? And we've just talked about how Bismarck he avoided the threat of communism in the 19th century. Let's skip ahead. Hold on. Let's skip ahead to the 20th century. And you can see the history of modern health systems. So Marx is dead. Who's the guy holding the shoe in his hand? Anybody know who this guy was? Nikita Khrushchev was his name. He was the premier of the Soviet Union. He took over from Stalin. In this famous picture, he is standing at the United Nations giving his speech. He takes off his shoe and bangs it on the podium to show how threatening the Soviet Union can be. Famous picture. This was the height of the Cold War. People were afraid of the Soviet Union. So how does the world respond to the Soviet Union in the threat of communism, which is committed at this point to taking over the world? So we're going to talk about how the Europeans respond, and we're going to talk about how the US responds. So how do the Europeans respond? I'll give you a clue. The same way Bismarck responded. So what does that mean? Let's get a Zoomer to tell us here. Some Zoomer volunteer. What happens in Western Europe with the threat of communism? What do you do?
Come up with an alternative to placate people.
Exactly, Rachel, thank you. You come up with an alternative to placate people. So if the communists are going to give everyone education, jobs, healthcare. What you turn around and say is great, you don't need communism. We will give you healthcare, jobs, and education. You create a social welfare system. You have a political party called the Social Democrats and another political party called the Socialists. You also have a political party called the Communists. Communists are going to take away personal wealth. You're not going to own a house anymore. Your bank account will be zero. You need something, you ask the committee and they'll give you a new car, a new mattress, if they think you deserve it. But most people didn't like that. I mean, as we know, communism has pretty much collapsed, right? Because it really wasn't popular enough, okay? But back in the 1950s, during the great threat of communism, there were communist parties. Italy, France, Germany, the UK. People, and of course there was a third of Germany was East Germany, was communist, okay? So they were very threatened. So give the people some of what they want and they'll be satisfied. So you have in Europe the creation of what is now called social democracy or social welfare state. People get a lot of stuff in Europe. Universal health care, free education. Why don't we have very many European students in our MPH program? Anybody figured that out? It's what? They talk about America, right? So why come to Israel, right? But why not just stay in Germany or Switzerland or France? What's tuition for a master's degree in Europe? Zero. They don't pay anything. Okay, why come to Israel and pay $10,000? If you're really rich, sure, go to the United States and pay $80,000 for your MPH, okay? Right? So we have trouble getting Europeans coming because they have to pay and they can stay home and get it for free. Why? Because they have a very strong social welfare system that includes education and healthcare and childcare and unemployment coverage, okay? Very strong social welfare system. The strongest comes in these Scandinavian countries. Okay, wow, what a surprise. Look at the data. Okay, now what happens in the United States at the same time? So I need somebody from the US to tell me who the Marlboro Man is. Anybody, any Zoomers can tell me who the Marlboro Man is? Cigarette, it's a cigarette advertisement, that's correct. Marlboro is a cigarette. Look at the guy, however. Let's see if we can enlarge him a little bit more. Hold on, everybody. Katie, I want you to tell me what you see here. Who is this guy? Not what's his name, but what does he do? He's a cowboy. He's a cowboy. What's the personality, what's the social structure of a cowboy? Freedom and independence, and they're for themselves. That's exactly correct, okay? So that's the American spirit. That embodies the essence of America, the cowboy, all right? So here you have Nikita Khrushchev and the Soviet Union threatening the United States. It does not respond the same way that Europe does. How does the United States respond? Builds a bigger bomb. We put our money into national defense, into armies, into bombs, while Europe is putting its money into social welfare. Okay? But we also let the market go. Our taxes are lower. We let the marketplace, we let businesses make wealth, which they do in the United States. And if you have a job, a pretty good job, you get insurance coverage. Okay, so as you look at health systems around the world, you begin to see how they have developed. Okay, and you get to understand the differences among them. All right? Okay, now we have about 20 minutes. So I'm going to try to go back and have us do a little debate. Okay? I think to make it simpler, Zoomers, I'm going to ask 2 of the 6 people here to volunteer to do this debate. And we'll set up the camera in a minute and we'll go over it. Let me tell you what the debate is going to be. And whoever volunteers to do this, you're going to have to think fast, okay? So back a few years ago, somebody proposed that in the United States, we change the way people pay for drugs. Now, we already talked about this Medicare D business, okay? Medicare D law. This is a little different. And they proposed that the United States adopt the German model for paying for medicines. So I've got it here. I'm going to read to you if I can find it fast. I can't. And I'll just tell you. No, I don't see it. Just a minute. Okay, I don't have it, so I'll just explain it to you. In Germany, the price paid for a drug is based on the incremental additional benefit that that drug has over the existing drugs in that market. So, here we go. Let's say we're talking about a cancer drug. And the cancer drug costs $1,000 US a dose, which happens for some of these drugs, okay? A new drug comes on the market. It improves the outcome by 20%, okay? So people live 20% longer, 20% more cures. There's some number that is 20%. I'm making this up, but just the point is accurate, okay? So in Germany, if the new drug comes out and it's 20% better, then the drug company will be paid 20% more. So they'll make $1,200 a dose. Okay? That's what happens in Germany today. That's been going on for a while. Say the last sentence? Okay. So, if the drug is 20% better, the drug company will be paid 20% more than the previous best drug. So let's use the example. Prior to this drug, the drug company would be paid $1,000 for a treatment. This drug is 20% better, so you get 20% more. 20% of $1,000 is $200. So the new drug, Germany will pay $1,200 for. Okay? That's the law. That's the way it operates. If you're Merck or Pfizer or Squibb, you have a choice. You either take the $1,200 or you don't get your drug sold in Germany. It's illegal. Period. That's it. Okay? Versus in the United States, where the drug price is set by the market, whatever that means, okay? And what that more or less means is that the drug company sets, the pharmaceutical company sets the price, and you either pay it as an insurance company or as an individual or as a hospital, or you don't get the drug. For that example, a 20% benefit, what would you guess the drug price would be? 100 times more, maybe 200, I don't know, at least double. It would be $2,000 a dose.
But if they want to sell it more, they can lower the price and sell it to more variety of people in the US, and in Germany they can't. They have
That's
to sell
correct.
it in a higher price.
That's correct, okay? So now, I can't find it offhand. I'm sorry. It's going to be in Moodle for all of you. But there's a letter to the editor to the Wall Street Journal, a conservative Republican newspaper in the United States, written by the CEO of Eli Lilly Company, one of the big pharmaceutical companies. And as this proposal is being discussed, he says, this is terrible. We shouldn't let this happen in the United States. Okay, so now what I want to do is I want 2 people to volunteer. We'll just take people in the room, Zoomers. I think we're tired and we got to finish in a couple minutes. Want 2 people to volunteer. One is going to say that in the United States we should adopt the German model. And the other, I want to say, no, we should keep it the way it is in the United States. Who wants to volunteer to do this? We got 2 of 6. Anybody? Nobody's jumping for this. Katie will do it. Dan is going to do it. Or Ezra. Ezra, you want to do it? Which of you? Dan wants to do it? Okay. Okay. Okay, so get 2 chairs, put them right over here, okay? What we're going to do is I'm going to give the 2 of them just, put them like here, just like this, okay? I'm going to move the camera, okay? We'll do this and we'll get it set. Now, what I'm going to do is for everybody else, okay, but I don't have Dan in the picture here. So what am I doing? There we are. Okay. Now, we're going to take about a minute before you guys start. And everybody else just get up and stretch for a minute. Give them a minute to think about what they want to say, okay? Okay. Okay, this is going to take like 2-3 minutes, that's all. Okay? Right? It's hard. It's hard, okay? You sit in class all day, but this is the only class today, right?
Yeah, only one class a day.
While we're just waiting for a minute, Maria offered for us to meet in the conference room at the School of Public Health instead of this room because of all the technology challenges.
Oh, in the hybrid room?
Yeah.
Oh, great.
No, not a hybrid room. No, this is in the School of Public Health.
Oh, yeah, we met.
The conference room. So let me think about that. Okay, you guys think about it too. I would like more Zoomers to come to class. Okay, you all understand that, right? Zoomers, okay? All right? Okay. So if it's only 6 people, I mean, there's room for probably about 10 or 12. When it gets to be about 16, it's going to be pretty tight in there. We don't have room for 18. Well, we don't have 18 anymore. We don't. How many people are abroad? Who's abroad?
Carolyn's abroad, Monica's abroad, Justin's abroad.
That I missed one.
Carolyn, Monica, Justin.
Justin, 3. Anybody else?
Some are in Tel Aviv. Wait, is Claire here now? Yeah.
Claire's coming and going. But. Okay, well, anyhow, so Zoomers, you think about it. We may, I would like more warm bodies in class. It's so much fun, Zoomers. Where are you? Here. Okay. Okay, right? Are you having fun?
Yeah.
Absolutely. Look how much fun they're about to have. Okay, let's go. So who's going to take what position? Okay, so now this is what's going to happen. You state your case. Dan states his case. You got about a minute and a half to state your case, maybe 2 each. Well, whatever. And then you each get 1 minute to respond to what the other one said. Okay, so you each get 2 shots at making your point. Katie, you're on.
Okay, so my side is the German point of view, that if your drug is a certain percentage more effective, you get paid that same percentage more for the drug by the government. And I think that would be better because you're incentivizing the companies to make drugs that are more effective. And that's better.
Okay,
All right, so the way the system works right now, it works. Not everyone's able to purchase higher, better drugs, but everyone's able to purchase a drug, and those who are able to afford better drugs can get better drugs. It's really that simple.
Is everyone able to afford drugs?
No, I don't think everyone's able to afford what they can. Yeah, it doesn't. Just because you have an issue and you need a drug doesn't mean you're entitled to the best quality health care, right?
Okay.
You deserve necessarily treatment, right? But not necessarily the best treatment.
Right, which would be the same for mine. It's not that the more effective drug eliminates the availability of the less effective drug. It's just priced incrementally.
Right. The difference is the free market in the States. If people are willing to pay more for it, which they are, the drug company wants to produce more and give more to the States, right? And they want to make better drugs continuously, right? And put them into distribution because people in the States are willing to pay more now. So if they're able to charge higher prices versus like a graduated increase, right? They're promoting more drug development, better drug development.
Are we sure that people go for the drugs because they're more effective or because their advertising is more effective?
If their advertising is more effective and their drugs are more effective and they cost more, which cost matters, like if people think things cost more than they think that they might be better, there's something that happens too. These are all positives to getting and creating better drugs.
Not necessarily. You can charge more for an inferior drug and people just think because it costs more, it's better, but they're not actually getting more for their money. Whereas if it was mandated that the price was proportional to the effect and the effect was measured and standardized by the government, then they would know exactly what they're getting for their money. It would be less wishy-washy.
okay, we're gonna stop. However, we're gonna stop this interaction, this dialogue. Are there questions either from Zoomers or from the other people in class for them, or comments? Anybody? Good job. Okay, very good, very good. Now, just appreciate this is the real world here. We're not just playing a game. This is the way the world is. Okay, this really was a proposal in the United States, which of course was not accepted, didn't come into law. Okay, right? But these are issues that have to be decided in health systems. Okay? And there's a very good probability that of the 20 of you, 2 of you have already gone altogether, Elad and Sarah, okay? Of the 20 of you, somebody is going to be on a committee someday that's going to make a decision about something just like this, right? Okay, so it's worth it to understand these are the issues that health systems face. Huh? Okay, now, comments or questions from Zoomers? Anybody? Okay, no?
I wanted to say that nobody talked about the company's perspective of things. Like they talked about the people and the politics, but not exactly like why would the company make a new drug if they don't make the money they want to make from it? Sometimes it takes millions of dollars to form a new drug nowadays.
Right, so let me develop that more, Ophir, thank you. Dan was being careful because he didn't want Katie to jump all over him with his argument, I think, with his argument that let me make as much money as I can get away with. That's capitalism, okay? If you buy a bottle of Coca-Cola, you pay a certain amount of money for it, right? What determines the cost of that bottle of Coca-Cola to you? What you are willing to pay, what the market is willing to pay. If they could charge another nickel, they would. They try it, and when they do, the sales drop. So the price of Coca-Cola is perfectly set to optimize the profits for the Coca-Cola company. I can assure you of that. Okay? And should drug pricing be the same? And that's what the pharmaceutical industry would argue. Now they have to make it look nicer. They have to talk about how they're saving lives, but it's really a business. Now, let's just say this as well. What incentive do they have to make new drugs if they don't have a profit incentive? The head of the company is going to lose his job if he's not making more and more money for the company. Okay? It's very interesting if you look at the COVID vaccines. Pfizer, who makes probably the best vaccine of all of them, chose not to take government money, which allowed them to make a bigger profit. They took a gamble. Moderna, the other companies, AstraZeneca, they took government money. It was safer. They're not making as much profit. Pfizer's making a bigger profit. They took the risk. They took the risk. Capitalism says they deserve the reward. Okay? So that's part of the argument in favor of the drug companies. What should be done? I don't know.
Do you know what they do in Germany as far as, making sure they break even on the research?
Okay, so what happens? So this is, okay, so Katie wants, did everybody hear what Katie asked? Okay, what actually happens in Germany? Do the drug companies play along with this or do they resist it? And it's complicated. This is a whole field called pharmacoeconomics, incidentally. It's a whole discipline about drug pricing, okay, because it's a big part. Go back to that spider diagram, the cost of drugs. It's a big part of healthcare. Well, this is the irony. The drug companies don't fight with Germany. It's a big country. It pays its bills. So if Germany says we're paying you 5% more because your drug is only 5% better, that's all they get, and they accept it. Okay, so the interesting thing is, it works, the German system works in Germany. And actually what happens, all these inflated prices in the United States help to support the pharmaceutical industry giving better deals in other countries. Okay, what happens in Israel? Anybody know? Boaz talked to you about this probably, didn't he? Drug pricing. What drugs do you get in Israel? Do you get all the drugs?
No, there's like a medicine basket that is added each year, specific like medicines and stuff. Or
Right.
Like small.
Right. So in Israel, it's either in the basket or it's not in the basket.
Yeah.
And there's a
It's not,
committee.
it's really expensive.
Yeah, you're not going to get it. Okay, you're not going to get it. Now, here's the thing. In Israel, there is one drug for each problem that you need, and it's a good drug. Is it the best drug? It's very close to the best drug if it isn't the best drug. Okay? Right, and there's a committee that decides it. Okay? People like you are on those committees. You have to finish your degree first. Okay? Get that ILE done, all right? Okay? No, but that's what happens. In Israel, you can't get all the drugs. In the United States, you can get anything. But not really, because it depends on your health insurance company. So your health insurance company says, you can get it, but you're going to pay just like in Israel. You're going to pay $1,000 for this drug. But if you get one that's similar, it doesn't cost you anything. It costs you $100. Okay? So in different countries, I mean, it's very complicated, but it isn't in other ways. Okay, everybody, I know we've had such a fun time. I wish we could, I'm sure you'd like to sit another 2 hours. Zoomers, what do you say? 2 more hours today? Y'all look so energized. Look at that. Well, at least Sebastian's smiling. Thank you, Sebastian, for the smile. Okay, that's good. Don't forget, he's locked in over there. Okay, you know, there's nothing on the walls, Sebastian. I hope you get out soon. Okay. Yeah, you'll be out soon. Okay, everybody, it's nice to see you. It's nice to be back. Okay, 2 o'clock on Thursday, we reconvene. Remember that on Monday, we have Rania speaking to us on the seminar series. Okay? Okay, everybody, goodbye.